Good afternoon, everyone. My name is Myung-Ri, and I'm from DGIST in South Korea. The title is Handheld Micromanipulation System for Precision Surgery, Endomicroscopy and Tracking System with Hole Sensor and Magnet Trocar. Ophthalmic disease such as epiretinal membrane affect around 7 to 12% of people aged 50 and older. ERM develops as fibrous layer on the retinal surface during healing after injury like posterior vitreous detachment. This membrane obstructs the optic nerves, resulting in blurred vision, double vision, and difficulty seeing fine detail. Typically, the membrane is very thin, measuring about 60 micrometers. The membrane must be physically removed through the epiretinal membrane peeling. This surgery presents several challenges. First, when peeling up the thin membrane, the surgeon may accidentally touch the retinal blood vessel, which can lead to bleeding. Second, surgeon must manage hand tremors that cause 100 to 200 micrometer displacement with frequencies of 8 to 12 Hz. These tremors significantly increase the risk of retinal damage during surgery. As an advantage of the compactness, we focus on the handheld device for microsurgery. Distance measurement to the sample surface and tremor compensation technique have been explored. The tremor compensation using optical coherence tomography (OCT). OCT provides high precision distance measurement, and it can respond to unexpected patient movement by identifying the distance between the reflective surface and the sensor. However, it is limited to measuring along a single axis in z direction. Various non-distance measurement to sample surface and tremor compensation techniques have been explored to reduce tremor. The IMU vision-based system and electromagnetic tracker provide the 6 or multiple degrees freedom tracking and compensation, but there are some several disadvantages of this system. We figure out some second topic as endoscopy for early diagnosis. These images explain the gastric endoscopy in progress, highlighting the role as a vital tool for early diagnosis for gastrointestinal condition. However, invisible gastric cancer cannot detected by surgeon because of this invisible characteristic. To overcome these challenges, various types of the endoscopic microscope have been developed. In addition, the single-type device, the developed multimodal endoscopic microscope is also actively progressing. So among them, some benchtop microscope have several limitations: resolution limitation, optical distortion, limited field of view, eye movement, and device size as complexity. In particular, probe-based confocal laser endomicroscopy require maintain the precise focal distance, which is often disrupted by hand tremor. Firstly, our proposed study introduces a handheld microsurgical tool with a 3-axis Hole sensor. The Hole sensor is attached to the needle and detects the magnetic flux density. This method overcomes the limitation of global tracking system and provides precise control in retinal surgery. Now let's focus on the relationship between magnet trocar and Hole sensor. So using multiple coordinate system and vector, we have defined the relation between trocar and sensor. And this slide explains how to find permanent magnet position. We use the Biot-Savart law, and we utilize 3 orthogonal components of magnetic flux density. This component can be simplified because the magnet and sensor are aligned along the z-axis. Finally, we use the effective distance between the two and surface the magnet is as a control variable. Secondly, we propose the novel handheld endomicroscopy using OCT and confocal microscopy. Here it is detail of the Trocar endomicroscopy system. We used Trocar system for imaging and use the fixed optical tomography for distance sensing. For tremor prediction, we used the GLU algorithm from the OCT distance data. These are information of the model parameters. This is a preliminary result for hand tremor prediction. So finally, we use the contour variable, which combine the tremor value predicted by GLU model with simplified PID controller. And also, we performed the simulation using ANSYS AEDT for magnetic flux density simulation. So we define some magnetic information in this simulation. And we conduct the hysteresis measurement using motorized stage and sensor. And we calculate p-value at every step. This is the overall result of this hysteresis measurement with every vector, component, and vector. And we obtained the p-value less than 0.001 in every step. Now let's see the experimental result of our tremor compensation using artificial eye model and porcine eye. RMS error are measured in this table. This video demonstrates the tremor compensation including artificial and porcine eye experiment. The red arrow is target distance as 1000 micrometer both samples. Secondly, we conduct the experiment with bovine eye for handheld endomicroscopy. So we divide some situation with control off and on in the OCT image and Trocar image. This is an experimental video using ex vivo bovine eye and handheld endomicroscopy. In summary, we have developed the both system as manipulator for vitreoretinal surgery and handheld endomicroscopy. So we developed handheld microscopy system that compensates for real-time tremor using 3-axis Hall sensor and ring-type permanent magnet. The other is handheld Trocar endomicroscopy system with GLU-based tremor control and common pass OCT distance sensor. In future work, we are implement it as multi-degree freedom system with Hall sensor array, and we will integrate this manipulator with robot platform as a multi-degree freedom manipulator. This is end of my presentation. Thank you for your attention.